How does intermittent catheterization help Ms. Bladder problems? Imagine trying to empty your bladder and feeling like it just won't cooperate. For many people with multiple sclerosis, this is a common challenge caused by nerve damage affecting bladder control. Intermittent catheterization offers a safe and effective way to manage this issue by helping to empty the bladder regularly and completely. It involves inserting a thin, flexible tube called a catheter into the bladder through the urethra to drain urine. This process is done at scheduled times, usually 4 to 6 times a day, depending on how much urine the bladder holds and how well it empties naturally. The goal is to keep the bladder volume between 300 and 500 milliliters to prevent overdistension, which can cause damage. In Ms., nerve damage can disrupt the normal coordination between the bladder muscle, called the detrusor, and the urinary sphincter, which controls urine flow. Sometimes the bladder muscle becomes weak and can't contract properly, leading to urinary retention, where urine remains in the bladder. Other times there is overactivity, causing frequent urges to urinate. Intermittent catheterization is especially helpful for those with chronic urinary retention or when the bladder doesn't empty fully. By regularly removing urine, it reduces the risk of infections, kidney damage, and overdistension of the bladder. Performing this procedure requires some training, especially for those with limited hand function or cognitive challenges. Proper technique is crucial to prevent infections, which are the most common complication of catheter use. Patients need to follow their healthcare provider's instructions and stick to the schedule to stay safe. Sometimes, intermittent catheterization is combined with medications like anticholinergic drugs to help manage bladder overactivity and improve overall bladder control. Overall, intermittent catheterization provides a reliable way for people with Ms. to manage bladder problems effectively. It helps maintain bladder health, prevents complications, and improves quality of life. Regular follow-up with healthcare professionals ensures the procedure is done safely and effectively, and adjustments can be made based on individual needs. Remember, each person's experience with Ms. is unique, so personalized medical advice is essential for optimal bladder management.